Now, some of you watching the BBC now will have experienced depression, and the scale of the suffering caused by this mental illness has been laid out in a new report. It's concluded that depression is second only to back pain as the most common cause of disability. And yet, mental health experts admit they know very little about what causes it. What we can say with more certainty is that only a tiny proportion of people with depression get any sort of treatment or diagnosis for it. So what can be done to get such a serious health issue the attention and treatment it warrants? Here with me in the Global Studio is the performer, author and mental health campaigner Ruby Wax, and also Dr. Robert Lefever, an addiction specialist and former GP here in the UK. Both of you, you're very welcome on the programme. When you hear this report putting mental health or depression as the second main cause of disability, is there a relief on your part, Ruby, that at last someone's pointing it out?
Well, I'm not relieved that so many people have it, but I'm relieved that this is going to be the beginning of breaking the stigma, because you know, there was a time where you couldn't say you were gay, and then you couldn't say cancer, and then a while back you couldn't even say you were a witch. But now it's the only way we're going to break this is if people speak up. And look at the numbers.
Do the numbers surprise you, Dr. Lefever?
No, they don't. I think depression is vastly overdiagnosed and overtreated. I think it's confused very often with sadness. Sadness is a perfectly straightforward reaction to distressing circumstances. But when you look at the prescriptions for antidepressants, doctors are treating sadness. They're treating unemployment, they're treating bereavement, they're treating bad housing conditions, all as depression, which doesn't work. You can't mend the road with tablets. You can't cure people from their social circumstances in that way.
I think that a lot of GPs are just throwing them out like M&Ms to keep them quiet, but it should be the line between depression and sadness.
Well, help us understand this line, Dr. Lefever. What would you say is sadness, and what would you say is depression?
When my wife died 3 years ago, I was desperately sad. Of course I was, but I'm not depressed. You know, I've got a life to live.
So what is depression?
Well, I can tell you that. I'm having it. Do you mind?
Yeah, please do.
It is, as you say, sadness and mourning are part of the human palette. When you have depression, I can't state it enough, there is no feeling. There is no sadness. It's just as if somebody filled you with cement. And it's as if you're hibernating and you can't wake up. And people say, well, could you be entertaining? Does it have to do with an artist? And I go, read my lips. It's 1 in 4. Mrs. Yorkshire has it. Mrs. Somalia has it. Forget about that it has anything to do. You cannot work when you have depression. You can't move your hand.
Right.
Yeah.
I think you're absolutely right, Ruby.
Yeah.
I don't use the word depression. I deliberately I use a complicated term, involutional melancholia. You know, we've really turned in on ourselves. We're drowning in melancholy.
And it is an area in the brain that causes it.
I think that's right.
They haven't put a lot of money into this, and had they put the money into, cancer and breast cancer and whatever, we might even have a solution for depression. It's not a sexy charity.
But is it, or has it become an umbrella term to describe what actually are a number of different mental illnesses?
I think what worries me is the use of the term clinical depression. That means, get out of my way, I'm going to prescribe. And I don't like that. It's using tablets. And the pharmaceutical industry makes vast profits from drugs that are only 20% more effective than cotton wool.
But I and you and Ruby and lots of people watching this programme will know people who have been treated with antidepressants who have felt better and who have got better in the long term with their health.
Antidepressants, and I worship at the feet of antidepressants.
Part of that is the placebo effect. If you give somebody anything, they will feel better. They will feel a sense of at least something's being done, somebody's listening to me.
But when you have a mental disorder, it is like, do you want to say to a diabetic, don't take the insulin?
No, I'm not saying that. I'm saying that people who have the involutional melancholia that I'm talking of, very commonly, that's the precursor of an addictive tendency. Because we use alcohol, we use drugs, we use nicotine, we use sugar, we use gambling, all to change the way we feel. Now, the treatment for that is not tablets. It's the 12-step program, first created by Alcoholics Anonymous.
But we're not talking about addiction. We're talking about depression, which a lot of addicts have.
I'm seeing the one leads to the other.
So talk to me, Ruby, about taking antidepressants. What do they offer you that no amount of cognitive behavioral therapy or talking can give you?
I think you have to do the 2 of them. But you cannot, when you are lying in a kind of coma, but you're awake, you cannot do cognitive therapy or mindfulness or whatever. So you have to get over this illness. Now, if it's a placebo, you know, it's certainly warded off mine for a while. Now, of course, they're not the answer, because otherwise everybody that was on medication wouldn't have a relapse. But it's all we've got. It's archaic, but it's all we've got.
So let me ask you this question in the few minutes we've got left. Just listening to the two of you, it's clear, and if you read about depression, it also becomes clear that there are not agreed definitions of it, nor are there agreed treatments of it. So when we bear in mind there's this vast problem as described by this report, how should the world's health bodies, how should the world's countries tackle this?
I believe we've got to recognize that there are vast numbers of social problems. They need social solutions, political solutions, financial solutions. They're not going to be solved by tablets. They're not going to be solved by doctors. Where doctors come in,
if you don't have tablets, explain to me how you deal with it. I mean, would you?
I did.
To me, it's like saying to somebody with cancer, cut the chemo.
No, I'm not saying that.
I mean, I think that's very destructive to say to people with depression, don't take the tablets.
No, I didn't say that. I'm saying I don't think that's the best way of treating it. When I was working full-time as a GP, when I was busy during the day, I say, come back and see me at 6 o'clock this evening, then we'll have some time. I think that is a thing that makes an enormous difference. People love being heard.
Oh, please, that's for somebody without a disease. Everybody loves being heard. But we have to understand every other organ in your body can get sick and you get sympathy except the brain.
So, well, 1 minute, Doctor. We've heard your response. I'll ask you the same question, though, Ruby. If you could advise the World Health Organization or the richest countries in the world, what would you suggest they do about depression? Put the money into brain research.
I've just, you know, I went intentionally to Oxford. I only graduated 4 weeks ago. Learn about brain research. It's in there. You know, we see where Alzheimer's is, and you wouldn't say to somebody with Alzheimer's, come on, snap out of it. You can remember what happened yesterday. So you don't say to a depressive, perk up. Perk up like I didn't think of that.
I agree.
All the time in the world, you are unconscious, you're out of it. You know, and it's an insult to say to somebody with depression, come and talk to me. You can't talk.
I fully understand that. I totally agree with you. I've been depressed like there's no tomorrow.
And did you take tablets?
I did not.
Okay.
I did not. Because I believe there's a better way of doing it.
Okay, but for those of us who do have to take it, don't make us feel ashamed that we do have to take it.
I would never do that.
Well, you're saying don't take the tablets.
No, I didn't say that. What I will say is that I think some people do benefit from taking medication, but not in the vast numbers in which they're prescribed.
No, those are, you know, those are, to me, as I said before, doctors saying get off my back.
But I treat the involutional melancholia. That's what I specialize in.
But we also need medication and therapy.
I don't agree.
Dr. Lefever,
you don't agree.
I've got to go to a break. I suspect you two may carry on talking once the cameras are
We may be much closer than it appears.
Can I mention my book that I've written?
She's done it. It's called Say New World.
Say New World, which is about not only medication, it's not about depression, but it's about mindfulness and
I said we were going to an ad break. I didn't realize it was coming this soon.
Sorry,
Ruby, thank you very much indeed for coming in. Dr. Lefever, we appreciate your time.
Take the tablets.